everyone. Welcome to the Digitech Health Leadership Talk podcast. This is a series of interviews promoted by the group working on digital and technology-driven transformations from the Young Executive Leaders Program by the International Hospital Federation. Thank you for showing your interest. For this interview, we have invited Mr. Diran Abidakun from Nigeria. Mr. Diran Abidakun is the head Blue Wolf Africa, a smart technology services provider with special interests in smart engineering, smart healthcare, and smart cities. He also serves as the CEO of CareClick Technologies, and a healthcare IT company committed to provision of increased and improved access to quality and affordable healthcare to Africans through the use of innovative telehealth solutions. Welcome again, Mr. Abida.
Thank you for having me. I'm happy to be here.
Please tell us by your words, who are you in the field of digital health?
Thank you. Well, for me, most of my career has been all around technology, using technology to intervene and bring about process development, product development, enhance business processes across different industrial sectors. So we've done this in the engineering sector, done this in the oil and gas sector, and for quite a number of years now, we've been involved in healthcare. Healthcare meaning there's a passion within me and my organization that for Africa to have comparable healthcare, which can be compared to the rest of the world, that technology must play a very, very, very large role. I mean, we believe that even as doctors are immigrating and going abroad, the only way they can help their people back home is through the use of technology. And we've always been doing this. So that has been our story within digital health, and it continues to deepen every day. Thank you.
How are organizations optimizing virtual care to achieve positive clinical outcomes?
Thank you. So, in terms of the optimization of virtual care, how organizations are using it and leveraging on it, I think I would like to separate the organizations we're talking about here. I think I would like to separate healthcare organizations or healthcare related organizations from non-healthcare related organizations. So for healthcare related organizations, let's do that, the HMOs of this world, the hospitals, how have we seen? Well, I think what we have seen since COVID is that, of course, the awareness is by far more there than what we had prior to COVID. There's an opportunity. We can see some form of encouragement to try it out, and this was what we didn't see. This was what we didn't see in 2017, 2018, even 2019. The year 2019, when you still speak to these health maintenance organizations and tell hospitals that, do you know that there's a lot of ways where you can use technology, where you can use video conferencing, where you can help your processes. No, they know what is telemedicine. But obviously, this has changed. Is it where it's supposed to be? Obviously, no. There's still a lot that needs to be done. There's still a lot that needs to be done in terms of awareness. There's still a lot that needs to be done in terms of policies. A lot still needs to come in terms of regulation. And but we're seeing that. There's definitely some development, and to a large extent, they have understood it. They are not leveraging on it as much as they should, but it is getting better. For the non-healthcare organizations, I think for them it's a bit. The interesting thing is that they I will say they have leveraged on it more, because what am I saying? The whole COVID experience allowed a lot of these organizations to try and make their staff to work from home, for example, and understanding that if this staff goes to the hospital, the chances of having the staff infected with COVID rises a little bit. So we saw an increase in their zeal to embrace telemedicine and look at it that it pays me for my staff to get all the care. He can decide remotely if he doesn't have to go. So he goes to the hospital, or she goes to the hospital for the most important thing. So they have leveraged on it, and even what we even saw was that it was some of these organizations, that's this non-healthcare, that had to be telling their health maintenance organization, or what we call HMOs, that we need these services. There are these companies that are offering these services, and we believe it's going to be good. Can you talk to them? So we can say that organizations have leveraged on it over the last 1.5 years. It's getting better every day, and I believe even moving forward, we'll see a lot of improvement. Thank you.
How do you feel that society is embracing mHealth or telehealth, and which are the fears and difficulties?
Thank you. That's actually a very interesting question. One would lie to oneself if one says the fear is not there. The fear has always been there. The fear is still there. I mean, we get it every time. We get it almost every day. Well, what do I need to see a doctor? Okay, what can you do? And questions. And these are natural things. Even in other countries, even by far more developed countries, we see these things that even the citizens. They are coming to understand the concept that telemedicine, virtual care, digital health in general can do a lot for them and their system. So the fear is there. What I will say about us is the reality is that where the highest impact of technology is going to come in by the time it has matured, it's going to be in the more rural areas of our country or continent, as the case might be. So what am I trying to say? What I'm trying to say is that in Lagos, for example, Nigeria using as a case study, of course we know that the healthcare in Lagos will be better than what you will get when you go into the hinterland, and that is what it is. So if we are going to be looking at where technology needs to play a great intervention, it is where most of these fears are more palpable. But what we have seen is the difference. They are ready to embrace it. They are ready to embrace it because maybe it's because they are choiceless. They have lesser options as you that are living in the cities. So I would say the fear is there, but the fear has not so much been the larger contributing factor for why we can say it has not spread as it should. That won't be the reason. It will always be there, even among the elite. Even among the elite, there are people that they will still be skeptical. Oh, I only spoke to this doctor online. I only saw this doctor online. This doctor was only able to review me online. But that will always be there. But I will say that there are other reasons that might have hindered or is hindering the preponderance or the spread of virtual care amongst the populace. But it is not that fear that will be the major root, although the fear exists. Thank you.
What do you think about the mHealth or telehealth strategy of Nigeria?
Thank you. That's a very good question. For Nigeria and I dare say a lot of developing countries and African countries, there were little had been done on telehealth and telemedicine prior to 2020. And for Nigeria as a country, in fact, when part of what we experienced was even looking for legislation, because some people even come and tell you that is it even right? Is it legal for people to see doctors over the phone? And it's very legal. I mean, go into the statute, you see that it's even encouraged. But as the government created a strategy that they need to work on for the development of telehealth technology in healthcare, I will say it was, if anything at all, it was a very, very infant stage. That being said, we have seen a lot of rapidity to bring some of these things into force. So, I mean, more technical meetings on the subject must have happened in the last 1.5 years than it has ever done in the history of healthcare in Nigeria. I mean, conferences, seminars, trying to understand telemedicine, trying to understand telehealth, how it affects different sectors, how even the social, trying to see the advantages that in many fields, in the field of psychiatry, for example, trying to see the advantage and how it can be embraced, how more awareness can be put in, how regulation can come in. So, a wholesome strategy as of today. So what we know is that government is playing an active role in trying to put some of these things together strategically, regulatory, and a lot of these things are still, we know it's not going to happen in a day, in a process that started over just a little over a year ago. But the discussions are more going, and we're expecting that soon, and very soon, things starting to be rolled out on how telemedicine can be embraced and can be operated within the confines of the healthcare space in Nigeria. I think that is where it is. If you, I mean, there are organizations that there are small departments in the Ministry of Health, and in Lagos State, for example, Lagos State is doing very well around technology and how technology can be used and deployed within their healthcare system to better the patients and to improve care. As a fully fledged strategy being developed and being utilized, we will say no, but it is a work in progress. But we will see a bright future. Thank you.
What is the impact of COVID-19 on mHealth and telehealth?
Thank you for that question. I will say, at least using Nigeria and even the US, that I have a very good idea about their healthcare technology and their healthcare system. I will say by far, the greatest game changer in recent times on the use and practice of mHealth, telehealth, as the case might have it, was COVID. Let's use CareClick as an example. CareClick, even as at January, February 2020, there were organizations that were in discussions with on the possibilities of using telehealth, using some of our products in their organizational systems, and where we were making no headway. I can tell you that 6 months down the line, completely, I mean, it was a different conversation, it was a different ball game. So, and this is many ways. Number one, people did not want to go to the hospital. People did not want to interact. People stayed away from each other. I mean, that's what came. You just had to speak to the doctor. I mean, I know doctors that all they did was consult over the telephone, informally, in most cases. So, to adopt in the adoption on the use of technology in healthcare, COVID was a major game changer, and it's still the major game changer. I mean, a lot of innovations coming into play, a lot of doctors, medical students trying to see. I mean, use Nigeria for example. Closer to 100 companies must have emerged on the back of COVID, trying to just use technology. I mean, different things to cure cancer, to consult for people, and in so many ways. So I think the impact of COVID on mHealth cannot be underemphasized. It was a major game changer. Thank you.
What actions should healthcare stakeholders take in order to realize the full potential of telehealth?
Thank you very much for that question. Well, there's a lot that can be done. There's a lot that can be done. But I think the first thing for stakeholders in the healthcare sector, now that we have all come to realize that strengthening and deepening the use of mHealth, telehealth, as the case might be, will overall increase the development and the improvement of the sector and the industry together. Now that we have observed that, the first thing together is regulation. There is a need to bring the institution and the industry around very strong policies. And what do I mean by that? No matter what we stakeholders do from the private sector, if we are unable to bring government in to form a unified strategy so that everyone is working together, a lot of us will be dissipating energy in different areas, and in that case, it will not augur well for the whole use of digital health. So it is important that all the stakeholders are working in one direction, and that can only be achieved optimally if government, by the use of regulation and by the use of very, very strong policies, bring the stakeholders together. So what am I trying to say? There are still a lot of practitioners, there's still a lot of people that want to go into telemedicine, but they are skeptical that what if government, because it's government can come out tomorrow, and after a lot of $1 million of investment, come back and takes you back 10 years down the line. So this is definitely stifling investment. This is definitely stopping a lot of people that want to put in their resources in improving the use of telehealth, because they're not sure what policy direction government is taking. So it is extremely important that strategically government brings the whole industry together. Then we from the private sector can drive the initiative. So I think the greatest strategy for right now is to make sure that both the public and private sectors and private practitioners and private users ensure that government is bringing everybody together under one umbrella of policy, then that would be the best way to achieve our strategic objectives with telehealth. Thank you.
So, Mr. Diran, how do you think the new generation healthcare managers should lead the mHealth or telehealth revolution?
Thank you very much for that question. Well, for the new generation, I think the major thing that they can do at this stage is majorly about education or awareness. And what do I mean by that? As of today, like I said earlier, there's definitely much more awareness than we had a year and a half ago. But notwithstanding, this does not make it adequate at all. There's still a lot, there are a lot of practitioners, there are a lot of medical workers, there are a lot of medical professionals that still do not understand how telehealth is being used all over the world, how mobile health, digital health can be used to improve their work and improve patient care and improve delivery outcomes. So what is very, very critical for this new generation is to ensure that not only do they educate themselves, but that they educate others, that they educate practitioners, that they educate government officials, most especially that they educate government officials on the advantages of telehealth. I think this will be very, very strategic, because how much of education are our medical doctors getting in medical school? We really cannot define that as of today. It is extremely important that the new set of medical professionals that have been churned out of our universities are trained and have very, very good background in the use and the advantages of digital health. This will be a very, very critical way in which this new care, because it's going to make their work easier, it's going to make adoption easier, adoption both for the practitioners and for the users. So I believe definitely education, awareness is the key thing. And once this is done, this is going to affect every other thing. It's going to affect policy making, it's going to affect adoption, it's going to affect the general use, even up onto the rural areas. So personally, I think the critical thing is awareness. Education. This is what is very important. So that I mean, it's education that reduce the level of awareness. But if this new set of people now that are leaving medical school, the new set that are just getting ready to go into the field, are vastly trained in the use of mobile health and digital health, I believe we'll see a larger rate of adoption than we currently have today. Thank you.
So my final question for you today is, how do you see the mHealth and telehealth technologies in 2050?
That's a very good question. Well, to answer that question, I think we can only answer that question in the light of when we see the way technology, especially mobile technology, is increasing at an alarming rate. So from the beginning, I think the whole telehealth and mobile health and digital health technology as we have it today has largely been driven by the rate or speed or improvement in technology and mobile technology in general. So what am I trying to say? This internet connectivity all over the world getting better is aiding telehealth. GSM communication all over Africa, all over the developing world, is aiding mobile health. So if we are able to project where we see technology being, especially in the light of the Internet of Things, in 2050, that will begin to give us an indication of where we are seeing mobile health. Personally, I think I don't think it's going to be in talking terms. I think by 2050, I mean that's over 20 something years from now, there would have been, in fact, I believe there will be a whole paradigm shift in the use of mobile health. I mean, I believe it will be completely different from where we are now. I mean, just take, for example, look at where we are over a year and a half and where we are today. A year and a half ago, we could say in Nigeria we had nothing. as of today, we definitely do have something. We definitely do have something, and what we have is getting better every day. If we're able to project it into 2050, that means I can tell you that there's no. And I tell people when I talk, I say, I do not see a doctor leaving medical school in the next 10-15 years and would not have a website. He will not have a website where a patient he or she has seen before can communicate directly with him or her. So I believe by then it's just, you can call it the doctor of the phone, because any doctor you see would have provided, or any facility you visit would have a very, very secure means through which they can reach you, or you can reach them through by the means of technology. You would not need to come back, except you need to come back. That's where I see it. I believe by 2050 there would have been a whole complete revolutionary change. I mean, well, a lot been driven by the developed world, but even a lot already going on here. It would definitely not be just talk. There will be a lot that would have been done. That is what we believe. That is what we are hoping for. That there will be a whole series of adoption in many facets, and we see a bright future for telehealth in general. Thank you.
So on this note, I would like to say thank you so much, Mr. Diran, for your time with us. Thank you for sharing your experience and your knowledge. It was a great pleasure having you. Thank you once again.
And once again, I want to thank you for having me. It has been a pleasure to answer all your questions, and I hope your research will also be one of the things that we'll see, and that will continue to drive the awareness we're looking for and the overall adoption in mobile health, telehealth, and digital health in general. Thank you very much. All the best.